All right, let's go ahead and get this started. And I see some questions coming in, and I'll answer those questions later on. That's coming in the chat section. This may be a little shorter meeting, but it doesn't mean that it's going to have less information. Just may be a little bit shorter. I do realize that there are some people who may not be here today because of there's other meetings going on within their counties, and there's also NHSA is having their virtual conference. All right, but there is some information that I would like to share, and I'd like to get a chance at the end to hear from you all on some of the innovative and creative things that you're doing at your programs that may help everyone else. All right, so let's begin just by going over just a few things that we'll cover today. All right, we'll take a look at the case updates as usual. We'll do some updates from the previous meeting, and we'll talk a little bit about the additional guidance on the CARES Act summer funding, and then we'll look at some of the enrollment Q&A that's on eClick. I don't know if you had a chance to look at it, but there is some important information in there. There's going to be an official guidance that does come out, but we'll take a look at some of those questions. All right, so let's begin with the case count in the region. Currently, there's 27,659 cases in the Washington, D.C. area. All right, 14,788 of those are in Maryland, 9,661 in Virginia, and 3,210 are in the district. And you can see the deaths, the correlating deaths underneath of the case numbers. PG County is our highest, has the highest number of cases in the state at the moment. And I would like to hear from some of those programs who are in PG County or operate programs in PG County, if it's impacting you any differently than it is in other counties. I think there's over 3,000 cases, maybe about 3,600 cases or something like that in PG County. So that number is definitely growing in PG County. So I would like to hear from you. Either you can send it in the chat, you can say it over the phone call, or you can just send me an email. But I'd really like to hear from you and how you're doing. And I will reach out to you just to talk to you a little bit about how it's impacting you and your program with there being so many cases in Prince George's County. As you are most likely aware, the governor has extended the closure of schools, physical schools, until May 15th. At that point, I guess they will reevaluate, and I would think at that point look to see if they're going to close for the remainder of the school year. All right, but it is right now, that date is May 15th, and I'm sure you are aware that everyone has, we are now required to wear a mask as we go into stores and out in the public and so on and so forth. And if schools were to begin, that may be the scenario if schools do begin. That's something that we would have to consider. Obviously, we were talking in the last meeting about a shortage of cleaning supplies and masks and things of that nature. If schools do begin, there is a possibility that we'd be in schools. Teachers may have to teach, and children may have to be in the classroom wearing masks. I think that's a definite possibility. So those masks would definitely be something that we need. All right, so speaking of the last meeting and some of the concerns that were brought up in the last meeting, one of which were the shortage of cleaning supplies. And I brought that up to Brenda Hewitt. She's the program manager for Region 3 of the Office of Head Start. We were on a call this morning, but I spoke with them last week after we brought up the issues. She has a meeting tomorrow with the National Office of Head Start, with the, all of the regions. And then she's going to bring the issue to the meeting This it's not just a state issue as we discussed last week. It is a regional issue. It's a national issue. I was on a phone call or a Zoom meeting earlier today with the other associations, as well as the Office of Head Start. And we discussed the issue and what we're going to do with the associations. I reached out to them after the meeting, and I talked to them about trying to pull together resources. Whatever resources they have, whatever resources we have, can we pull it together and then see what we have, see how we can help each other. And when I say resources, I'm not meaning actual physical cleaning supplies, but resources of people that we can contact. See if we can pull those things together, and then together contact some of the larger businesses and corporations and see if we can garner some of their support and trying to find and trying to get cleaning supplies to Head Start programs. All right. I will keep you updated. Brenda, she's bringing it up on a national level. We're trying to attack it regionally with the associations, and then statewide. Jen Nizer, she's director of the Office of Child Care. She is aware, because this is not just impacting Head Start, it's impacting child care programs as well. You have the Maryland State Child Care Association, who is aware of the issue. I was on a call yesterday with them, and they brought the issue up as well. Jen Nizer is addressing it with the Office of Child Care, seeing how they can make connections to help bring in more resources for all of the child care programs, including Head Start. Okay, so we'll definitely continue to stay on this issue to make sure that we, or try to make sure that we can get supplies, as many supplies as we can. I did send out an email yesterday, and if you can give me a list of the type of supplies that you need, the more information that I have, the better. So when I go to some of these businesses or I'm in meetings with whoever I'm talking to help address the issue, I can say, here's the things that we need directly. If you can email that to me, that would be great. All right. So that I can, have a good list. And we'll work together with everyone to try to get as many supplies, cleaning supplies and sanitation supplies to you all. All right. Now, we also discussed about being creative and how program directors are a little bit, I don't want to say nervous, but apprehensive about this being creative and, whether or not it could come back as a misuse of funds in the future. Now, the Office of Head Start has said that with this summer funding and the QI funding, they're going to be very flexible. But we all know, that could be, they could say that now and then, some other things turn around later on. So I brought up the idea to Brenda Hewitt once again, and on her meeting tomorrow, she's going to bring it up to the National Office of Head Start. She's going to bring it up to national. But it was not something she could do immediately, because originally I wanted to see if we could get her on this call and get our teen TA or whoever else on this call, to kind of have a forum about it. I think it may end up being something that's a little bit bigger than just statewide. It could be regional, and it could be like a regional, a virtual roundtable or a virtual webinar or something like that. That takes place, because on the call this morning, there were other programs or other associations who spoke to their programs, and they have some concerns about the funding altogether, and some of the instruction with the funding altogether. So it's something that we could kind of put together and have a webinar or something where we talk about the funding, some of the requirements, some of the ways to write up the grant, talk about being creative, how to keep that documentation, who to submit that documentation to, and all of those type of things. All right. So it is something that could be in the works. She is concerned as far as her staff about time, because they're being stretched and pulled in so many different directions with everything that's happening with COVID-19 and funds being uh, distributed and those type of things. Being pulled in a lot of different directions. So we've got to find a timeline that works. Obviously, it needs to be a timeline that's before the grants have to be submitted, right? Because we need some instruction. So she is looking for a timeline. That's what she asked. She said, what kind of timeline are we considering? All right. Obviously, she couldn't do it immediately, but I did explain that it would need to be before applications are submitted. So what kind of timelines? I'd like to hear from you. What kind of timeline would you be thinking about? Maybe something early next month? All right. And she wants to know what are the actual goals and objectives. I tried to explain it the best that I can, but I guess she's still looking for, what are the actual objectives? What is it that we're really, really concerned about with being creative that they could answer? So, if you could, either on this call later on, or you can leave it in the chat, or, you can email me and just, what some of your ideas on what, excuse me, the actual goals and objectives would be. But I think it's something that we could put in place or something that we could do on a regional level. Okay. But, she said plenty of times, they're kind of swamped as well. Now, this Friday, I have a call with the TNTA system. I don't know everything that's going to be on the call and, what they have planned, because I do know that they've got to renew their contract. So maybe they'll give us an update there. But I will bring this to the TNTA system as well and see if there's anything that they can help us with. I forgot how long when their contract actually ends. I probably have more information on Friday when we sit on the tap call. Okay. So I'll bring it up to them and see if that's something that, that they can help us out with as well. All right. Now, and in the chat, Alberta, thank you. She said, on our call today, the fiscal manager stated there will be a 7-page document coming out to talk about the use of funding by the end of the week to all Head Start grantees. Yes, and that's exactly what I was going to talk about next. As it pertains to the summer funding, there's going to be additional guidance on the CARES Act summer funding that comes out, and actually it's supposed to, the Office of Head Start wanted to have it out by the end of today. I don't think it's going to be by the end of the day, as according to the person who was speaking on our meeting this morning. He doesn't think it'll be by the end of the day. He thinks more likely by the end of the week, as was just as Alberta just said in the chat. So we should look forward to receiving this guidance. And yes, it is 7 pages. I have not seen it. He was actually looking at it when I was on the call. He was actually looking at it. He had it there. I guess maybe they've got to go through and make a few adjustments and some corrections or whatever it is. But hopefully by the end of the week, we'll be able to have this additional guidance on the CARES Act, which should hopefully will address some of the questions that they've been getting nationwide about how to apply and those type of things. I don't know how much it's going to address being creative, and we continue to hear the words being creative. We don't know how much it's going to address being creative, but we'll look at it when it does come out, and we can talk about it on our next call here, and any questions that we have, and we'll be able to submit it to our regional office. Okay, so be on the lookout for that sometime this week. Today's Wednesday, so you got Thursday and Friday. Be on the lookout for that sometime this week. Okay. And when it does come out, I'll make sure that I send it out to you and so on. Now, if you go on to eClick, and I will show it on the screen, and I tried to summarize some of it or pull out a few important pieces here. But if you go on to eClick, they have an enrollment Q&A that's there, because there's been a lot of questions about enrollment. Now, they are working on an official piece of guidance to give to all grantees. But this is what they've put out so far. The first question, there's 5 questions. The first question, should grantees continue to report monthly enrollment? And the short answer is yes. Now, there's some more in the paragraph, so you might want to make sure that you go check it out. Okay, I did send it in a link yesterday, and I'll send it again. But something important that's in there says, even if the program has not been able to engage a family during this time, OHS expects the program would consider that slot enrolled unless the family has told the program they will not return. Okay, so if you have not been able to contact the family or engage a family and they were enrolled before the cancellation of school, you should consider them still enrolled. Make sure that you check that out for yourself. Okay, I did quote it from the website, but still make sure you go on the website and check that out. Now, question number 2, should programs continue to report monthly enrollment if services and engagement activities are significantly limited in some areas? Short answer is yes. And there, like I said, there's more in the paragraph, but what I pulled out here is grantees struggling to find ways to maintain contact and engage families should reach out to their regional program manager. All right, so please make sure that you're in constant contact with your regional program manager. I would recommend sending emails and then following up with a telephone call. All right, that way when you have the email, at least you sent the email. And you have documentation that you sent an email about whatever the question is. All right. Number 3, should programs continue to actively recruit? Now, here, they don't give a yes or no answer, but they make the following comment. They say, identifying eligible families now will support reaching full enrollment when operations resume. Now, I know, obviously, there's people who are still engaged in trying to not just enroll families for this year, but for next year. And a lot of the questions revolve around, how to collect that documentation. They don't really address it here in this enrollment Q&A. Hopefully they will in the full guidance that's going to come out. But they don't address it here. For this question, this paragraph, they say a little bit in there that, programs are being innovative and using telecommunication to be in contact with families and stuff like that, but they don't really address or give any guidance about it. Question number 4, during program closures, can a program enroll eligible children from the wait list if there are vacancies, even if they haven't been physically present at the center or received one home visit? The answer is yes. If there is adequate documentation on file to verify a child's eligibility, and there are services your program can provide to benefit the eligible child and family. Now, there's a little bit more in that paragraph. Again, I pulled out what I thought was important, but please go read it. So yes, you can enroll eligible families from the wait list if you need to fill your enrollment. The last question, what enrollment reporting flexibilities is OHS providing during this time? I took the entire paragraph here. Okay. Reported enrollment figures will not be considered in determining a grantee's enrollment status during this time. Okay. OHS will continue to monitor monthly enrollment, but will pause its evaluation under or fully enrolled grantees until operations resume. Okay, so they will pause its evaluation of programs who are under enrolled or fully enrolled until operations resume. Again, please make sure that you take some time and go check that out. All right, so you can read it all for yourself. Be on the lookout for some guidance to come out about enrollment sometime soon. I'm not exactly sure when that will be. I will show you the page, briefly show you the page. Here's the page where you will find the enrollment Q&A, and you can see it was last week that it came out. And you click on this link here, and it'll take you to the enrollment Q&A. You have guidance for all grantees, and then you have grantees in the full enrollment initiative. I don't know how many grantees we have who are in the full enrollment initiative, but if you are, there will be some guidance here for you as well. All right, so please make sure that you are checking this page often. There's a link on our website, on the Maryland Head Start Association website, because this is where they are. A lot of updates are coming to this page, and you can see here on the side, they give us just an outline of what to look for. All right, so that you can click on these links here, and it'll take you to whatever you're looking for those links. And then the last thing I want to share before I open it up, and I'm not sure if Tressa is here on the line. If Tressa is here, I'm going to ask Tressa to give us any updates. But the last thing that I want to bring to your attention is, let me see if I can, here we go. Last thing I want to bring to your attention is that this Friday at 2:30, there is a webinar that'll be put on by the Office of Head Start. It's called Caring for Children in Group Settings During COVID-19. It's from 2 to 3:30. You can register online. As soon as I'm off of this call, I'm going to send you this link so that you can register if you want to participate in this webinar. I'll be on the webinar, just watching, listening in. I'm not going to be giving the webinar. I'll be on the webinar. But please, if you can, this will be a good webinar to start preparing for reentry, in case reentering into the classroom. All right. So with that being said, that's really it for me today. I did want to open it up for you. I'd like to hear from you all just some of the things that you're doing in your programs to be creative and to help just to be creative. Anything innovative that you're doing that you think might benefit everyone. I have unmuted you, so if you'd like to join in, please feel free and share. Or if you have any other questions.
Hi, Simeon and everybody.
Hey, Tressa, how are you?
I'm good. I seem to be under the pseudonym of Alberta.
Oh, oh, that's you.
I did it.
All right.
But anyway, I've been here.
Okay, yeah. You know what? I didn't know. I didn't know that was you.
No, of course not. That's my name, and I don't know how I did that.
All right.
Anyway, hi to everybody. Just wanted to let you know Wendy's back with us. I think I told you that last week. And we're going to be getting ready to send out a much easier to complete Head Start State Supplemental Grant Application Packet. So we've got some, I think it'll be 4 pages that you fill out. So we'll give you some directions with that, and then it'll be 4 pages to fill out, 2 of which are budgets, and one's what you're doing, and one's who you are. So that should make that process a whole lot easier. We're starting the grant. This is the state supplemental funding. We're starting the grant as of July 1st to be in line with the rest of the state fiscal funding year, but we're going to let it go longer than a year and end it September 30th, so we're not cutting off funding in the middle of your summer program. So wanted to share that. On our website, I looked around on the MSD website for local emergency management places and called them up to get, to find out about getting materials. And as Simeon has alluded to, they're just not to be found. So their best idea was to go early in the morning to a big box store and see what you could buy. So I guess my next thought is to send the most senior member of your crew who could get in at the senior hour when they're fully stocked and see what you can get.
Yeah.
This is the offer there.
And somebody, I forgot to mention this earlier, so I'm glad you brought that back up. On the call with the Maryland associations with Jen Nizer, someone said that the resource centers have been collecting items, cleaning items. So, if you maybe check those resource centers in your county, maybe they can help you out with some resources, or maybe they have some items.
And unfortunately, I think the priority for those items would be for those essential personnel programs that are open and running right now.
Okay. Oh, right.
Yeah.
Okay.
Yeah. I have a question for folks. If you could let me know, I'm going to be talking with my team at the University of Maryland, the Parent, Infant, and Early Childhood Mental Health Group, and they're kind of wondering, what do you foresee as your needs for early childhood mental health as you get back restarted and stuff? So if you have anything you've thought about or anything specific, tell me now, or put it in the chat box, or send me an email.
Simeon?
Yes.
Hi, this is Mary Gunning.
Hey, Mary.
I just wanted to follow up, Tressa. First of all, thank you so much for the 4-page application, whoever was involved in that decision. I know that's a huge relief for me and probably a lot of other programs, so thank you for that. As far as
easier for us too.
True, and by now you probably all know who we are and kind of what we're about. So anyway, that said, I think the mental health conversation bears a really, serious discussion, as we all know on this call. I'm just particularly thinking about not only the need, we've been talking about this in Baltimore City, but not only the need for our children, but also the need for our staff members who have also been, many of them traumatized and, anyway, period. So more mental health, that's what I would say. More mental health consultants. Training's fine, but I think we really need more counselors and therapists actually on site in the centers to provide support as needed when things arise, but also to be there for. I'm going to talk. I'm sorry, that was very long-winded.
No, that's fine. I appreciate your input, Mary. And I would agree. Training is fun, resources are fine, but people really need other people, consultants and folks that can help and support them.
Yeah. Okay.
Simeon, this is Teresa. It's funny we're talking about this. We actually have a meeting with our regional education specialist tomorrow to look at professional development training for the year. And we had a brief brainstorming meeting so that we could put an agenda together for tomorrow. And there were a number of things that came up. One was re-entry training for staff, the attachment issues that some children are going to have, being that they've been in so long with their parents, not wanting to come back. We also talked about training in terms of grief training for staff in particular, but there are a lot of students that may have family members outside of this area in New York or one of the harder hit areas, or even locally where they didn't get a chance to say goodbye. So those were just some of the hot topics that came up from our brainstorming meeting. And the fact that it's going to need to be ongoing, because We talked too about the fact that we know some kids that we had behavior issues before we left. Those issues are probably compounded even more so now that they've been home. The abuses that are happening in Calvert, the abuse rate has just escalated. We've got a number of sheriffs that we keep in contact with, and most of their calls are now for domestic violence and abuse. And it's not just the parent or an adult, it's also an older sibling that may be abusive to a younger sibling. So those are some really hard to deal with topics that staff will really need some serious training and support on in terms of dealing, either before or when we return.
Yeah. No, those are definitely important topics. As I mentioned in the last meeting, one of our initiatives for this year, as we're working with Trust on this state strategic plan, is mental and behavioral health. And so this is great information for me to take down. I'm writing it all down as I'm reaching out to people. What I'm hoping to do in the coming weeks during this meeting here is to have some people that can come on and maybe give us a short webinar. We had last week Sandra, got her last name now, who is the CEO of Bright Horizons. Bright Horizons, right? And she was asking me about some free training or webinars that she can provide. Sandra Brooks, yes, about some free training or webinars that she can provide, so that she can be of assistance. So these are some issues that some topics that I'll bring back to her. And Mary, she also, and her program is also available to come to the site to provide some on-site consultation. And she's just one. She's just one person that reached out to us and wanted to lend her support. So I'll reach out to her as well as many others about some of these topics that we can bring right here on the webinar. I know last time her sound wasn't as good, but we'll make sure that that's fixed the next time. But that we can bring right here on the webinar, so we can start trying to do some of these things before they re-enter and have some of this knowledge before they re-enter the program. So thank you very much.
Jimmy, I just want to mention too the new release the new release for additional guidance of funding applications in response to COVID-19. They just released it, so it should be in everybody's email.
Oh, it just came out. Okay.
Yep, just came out.
All right. All right, good. And I'll make sure if anyone didn't receive it, I'll make sure that I send it out to everyone as well. Anybody else want to share anything that you want to share about your programs that you're doing, or if you have any other concerns with that? Teresa, I see you asked, could we talk briefly about how programs might be using the QI funding?
Yes.
Yeah. Well, I guess we can start with you. What ideas do you have for using it right now?
I wasn't real sure.
Yeah.
I know the trauma-informed care we are certainly looking at. We're going to look at certainly increasing salaries to match the school system salaries. Those were the two areas that I knew I wanted to look at, but I wanted to try to get some feedback from other people to see if there were other ideas out there that I hadn't, or we hadn't thought about or talked about yet.
Right. Is there anyone that's on the line now that has some ideas or some things they're doing with the QI that you'd like to share?
Can you hear me? Simeon?
Yes. Yep.
Okay, this is Marisol from MRDC Head Start. Some of the ideas that I was considering was buying materials for the calming corners, providing training to the staff and coaching the follow-up to those trainings in regards to the trauma-informed approach, because it's kind of new to most of our staff. So we want to make sure that we provide them the training on it as well. We have the mental health also getting involved too, to provide services to the children. So I was thinking of incorporating that also in the grant.
Okay. Anybody else like to share some other things?
Yes, this is Mary. We are going to hire what we call support aides. I mean, not hire, excuse me. We are requesting money for 5 support aides, and they are the one-on-one aides that can assist with the children with challenging behaviors, many of whom are suffering as a result of childhood trauma. And then with a little bit we have left, we're doing the same thing that Marisol is doing. We call them our cozy corners, and some of them are like the Ritz-Carlton, and other ones look like, you know, a Motel 8. So we're trying to kind of upgrade the ones that need.
I like that.
But you really want to go get cozy. So, but the bulk of it is going to go to personnel to work 30 hours a week in classrooms with children that are requiring extra help.
I like that.
And I should add that that comes out result directly out of pretty much what a lot of staff have been saying, you know, through staff surveys, through even parent evaluations. So it was, you know, not something that we came up with on our own. It's usually the Head Start way, but we had a lot of comments about the need for that. So this was perfect. And we've applied in the past for foundation funding for it, but have not gotten it. So this was great.
Okay, great.
Does anybody know if there's a percentage of these funds that can only be used? Is there a cap on the salary piece?
Based on what they sent out so far, it really wasn't a cap. Now, with the new guidance that they just put out today, that may change, but the initial guidance, there was none.
Okay.
This is Teresa again. I just want to say thank you to those who did share. There was some ideas that we hadn't considered, so this will be helpful. We have a policy council meeting Thursday evening, so we can throw out additional ideas to them as well. So I appreciate that. Thanks.
All right. Anyone else like to share? Or have any other questions or feedback?
Simeon, I had met with my TNTA from Region 3, and I know I was on the phone when you was addressing this, but you had said that you needed to find out when was the ending of their contract. And based on my conversation with my TNTA, she said their contract ends in July, and so all their travels has to be done. They have to have it all scheduled before the second week of July.
Okay. Okay. Great. So, well, I mean, I doubt they'll be traveling anywhere, but I'll meet with TNTA this Friday. We'll have our tap call this Friday. We can talk about, you know, maybe having some kind of, you know, a few things, try to fit a few things in before they're done. I don't know what parameters they're going to have, but we'll talk about it.
Right now, they were just with me in my program. They were doing virtual meetings for right now.
Right.
So.
Right.
And this is Teresa again.
Oh, I'm sorry. Go ahead.
I was gonna say, I just wanted to share there was an email that came out. I don't know if everybody got it from Region 3. They are offering a number of virtual trainings. So if you didn't get a chance to look at that, you might want to look at that too. They did address some of the issues that we were talking about earlier. So you get a chance, take a look at that.
I missed that one.
Let's see if I can find exactly what time they sent it out. Hold on.
Is this the email that has the they talk about the bulletin board as well?
Yes.
Yeah. And there's a list of a professional development list, right?
Yeah.
Okay. Let me see if I can pull this up on the screen. Yeah, so it's up on the screen now. You should have received this from the TNTA network. If not, I can send it out to you. I just forward the email to you if you haven't received it. And it goes through, it's the 2020 Virtual Professional Development List. You know, and it has the session name, the description, and the intended audience. So yeah, this is something that you might really want to take a look at. And I can probably get some more in-depth information about all of these on our call this Friday.
Could you forward that to me, Simeon? I don't think I have a copy.
Okay. Yep. I will make sure to forward it to you.
Forward it to me too, because I'm not finding it. This is Marisol.
Okay. Yeah. I'll make sure I send it out to everyone. Forward it out to everyone. Yeah. Yep. And just one more thing before I get out of here. I do want to remind everyone that we are still going to do the Parent of the Year. We're going to do it in a virtual manner. All right. There should be an application coming this Friday where you can, the normal application. And then what we'll do is we'll use GoToMeeting or Zoom, and we'll have the parents come in and we'll honor them in a virtual manner. And then, we can have, 100 people on the call. So, 100 or more people on the call. So people would be able to, parents would be able to join, staff would be able to join in, so just look forward to that coming this Friday. And then we'll send you information on how the whole thing is going to work. Okay.
Simeon?
Yes.
Simeon? I'm sorry. I'm sure it'll be on Friday, but did you say what the date is for that?
No. We didn't say the date yet, but you should have that information. If you don't have the exact date by Friday, you'll have the application by Friday, and then you'll get the exact date later. Yeah, because we're still working out, how we're going to do the platform and all that kind of stuff. Okay. So, are there any more questions or concerns? Okay. Well, so I'm going to follow up on some of the things that were in here. Of course, I'm going to continue to follow up on the supplies. And I'm going to look through the guidance that came out, and I'm sure you'll look through it. But anything that I see, I'll try to, pull that out with anything that I see there. Any other updates that I get, I'll make sure that I send it out to you. And then we'll meet next week. Again, if you can send me a list of the supplies that you might need, please do so. That'll be very, very useful. And I'm going to try, I don't know if I'll be able to do it next week, but I'm going to try to start having some people that can come on and give us a little bit of training, maybe, some short webinars here that can, that with information and training that we can use as we begin to re-enter. Okay. So I thank you all for the time, and be on the lookout for emails and you know, just me being in contact with you throughout the week. And I look forward to meeting back with you next week.
Okay,
Likewise.
thanks.
All right.
Thanks. Nice talking to everybody. Bye-bye.
Bye.
Bye-bye.